Hi, my name is Terry McGee. I am the Director of Education for Rehab Therapy Services at the Johns Hopkins Hospital. I'm a physical therapist, board certified in orthopedic physical therapy, and a fellow of the American Academy of Orthopedic Manual Physical Therapists. Physical medicine and rehabilitation, or PM&R as we like to call it, focuses on the rehabilitation of individuals with a multitude of diagnoses. We cover everything from musculoskeletal disorders to neurologic. We have physical therapy, occupational therapy, speech-language pathology, as well as our physiatry staff and rehab psychologists. The great thing about our department is, especially on the rehabilitation therapy services side, is we offer a significant number of post-professional residencies and fellowships that cover physical therapy, occupational therapy, and speech-language pathology. The Orthopedic Certificate Program is a new venture through the Department of Physical Medicine and Rehabilitation. And what we've done is taken our orthopedic physical therapy curriculum and converted it to an online format so that we can impact physical therapists as well as other healthcare providers across the globe. It's broken down into 5 courses, ranging from introductory courses on evidence-based practice, medical screening, clinical reasoning, and then covering a body region-specific focus to help healthcare providers, in particular physical therapists, really specialize in orthopedics and the management of musculoskeletal disorders. Well, the program is specifically geared towards physical therapists, but any healthcare provider that is engaged in the care of musculoskeletal disorders would benefit from learning from this practice. It would give them greater insight to how physical therapists name and treat musculoskeletal disorders. But primarily, like I said, it's a great way for physical therapists to really improve their clinical acumen, to improve their ability to diagnose and manage musculoskeletal disorders. We have a series of pre-recorded lectures that will be assigned on a week-by-week basis. And then there will also be assigned readings, discussion board posts. Some of the courses have quizzes that will have to be completed. And then in some cases, also a cumulative final exam to really help tie things together. And then the other portion of it is the psychomotor skills portion. COVID has done a lot to impact our way of educating healthcare providers, and in this case, physical therapists. So what we've done is we've taken our clinical faculty who have over 70 years of clinical practice combined, board certified in orthopedics, manual physical therapy fellows, and we've recorded them performing the most evidence-informed or evidence-based manual skills so that you can learn, observe, and then replicate. In addition, faculty will be available for synchronous learning through live lectures, as well as virtual office hours, and they will be participating in the discussion boards. And then there will be opportunity for participants to be able to ask questions and also through live video feed, demonstrate or get feedback on psychomotor skills that have been taught throughout the course. So the first course in the program is really going to delve into and tackle topics like clinical reasoning, evidence-based practice, and medical screening. And the great thing about what we've done with course 1 is we've integrated a cumulative final where we're going to provide you with a case and you're going to break it down and really demonstrate to the instructors how you have been able to integrate the current best evidence to determine whether or not a patient is safe to evaluate, needs to be referred and evaluated, or just referred out because of concerns of a more sinister pathology. So course 2 is the first in the series that will break out into a modular approach focusing on musculoskeletal disorders. And in this case, the instructor is going to delve into the Academy of Orthopedic Physical Therapy's clinical practice guideline on neck pain. Topics covered will include mobility deficits, neck pain from headaches, neck pain with related upper extremity pain, neck pain from whiplash, and then they'll also cover the temporomandibular joint or TMJ dysfunction. Course 3 will once again delve into the Academy of Orthopedic Physical Therapy's clinical practice guideline, but this time it'll be on low back pain, and in particular, acute and chronic low back pain. So topics covered will include low back pain with mobility deficits, movement coordination impairments, related or radiating lower extremity pain, generalized pain, and cognitive and affective disorders. Course 4 will continue on with a modular approach to the management of musculoskeletal disorders, but this time the focus is on the lower quarter. The course will start looking at the hip joint, and in particular, mobility deficits in the hip, as well as the non-arthritic hip. Then instructors will go into the knee, and topics covered there include patellofemoral pain, meniscal injuries, articular cartilage injuries, as well as ligamentous injuries. And then lastly, the instructors will focus on the foot and ankle. And there we'll look at Achilles tendon injuries, including muscle power deficits, ankle sprains and chronic ankle sprains, and then heel pain. So Course 5 is the last in the series of this certificate program that continues on with this modular approach. In this case, the instructors are going to focus on the upper quarter. So lectures will start with the shoulder joint, and in particular, focus on shoulder pain with mobility deficits or adhesive capsulitis. From there, they'll look at movement coordination impairments or impingement syndrome, and muscle power deficits or rotator cuff tears. After that, the instructors will delve into the elbow, wrist, and hand with a focus on mobility deficits or stiffness, movement coordination impairments or instabilities, and then hand pain and sensory deficits. So at the completion of the program, participants will receive a certificate of completion from the Johns Hopkins School of Medicine. They will be able to distinguish themselves as a leader in orthopedic physical therapy amongst other healthcare practitioners, as well as physical or physiotherapists in their respective clinical settings. And they'll truly distinguish themselves as a leader in the healthcare field. You can attend one of our upcoming informational sessions where you can meet myself, as well as several of the faculty that will be present and be able to answer all of your questions.